So, what are different types of epilepsy surgery?
Oh, well, there's a lot of things. Some are palliative rather than curative. So sometimes we just try to make your seizures better. And then there's even operations where we don't go after the target, but try to just change the way things spread. For example, corpus callosotomy is an operation where we just divide the two hemispheres. And then there's a lot of operations now where we go after electrical modulation or some other way to change the way the brain communicates within itself to stop having as many seizures. And that would include vagal nerve stimulators, deep brain stimulators, and responsive neurostimulation. Did I miss anything?
I think that covers it. And I think one of the take-home messages really is there's a wide variety. It's a lot of complicated factors that go into making these decisions. And again, we talk about the team approach as being so valuable to try to decide what is the right surgery for a given patient.
So what happens after epilepsy surgery? People ask, do they keep coming to see you? Do they go to see their neurologist? Do they go back home? What happens?
Well, obviously it's going to depend on the patient and what the surgery is, but absolutely, the care doesn't stop after the surgery. And follow-up is important with team members. The patient will always see the surgeon afterwards to make sure that everything is healing fine and there are no early post-operative concerns. We're obviously going to continue to follow the patient for their seizures. Many of our patients will be seizure-free, which is great. Some won't and are going to need continued care. Are there more steps we should take? What do we do with the medication? Most patients will stay on their medication for a while and then maybe slowly come off it under the guidance of their neurologist. So the long-term follow-up is really critical here, and certainly, the team approach does not stop at the end of the operation.